Hi everyone, welcome to another episode of Nashty. It's about you and me. So today will basically be just a continuation of my Gynecomastia vlog series. And for this episode, we will be talking about before the surgery. So basically, what are the things that you have to prepare for? What are the things that you have to do before you get the surgery? So let's find out. You've already decided to get the surgery. I'm assuming that you have already talked to a doctor. By doctor, this should be a surgeon, a cosmetic surgeon, a reconstructive surgeon, a plastic surgeon. So they're a surgeon. So what are the things that you have to do prior to the surgery? Well, there are some things that you have to bear in mind. Number one, of course, I think this is the most important thing. You should have the budget. As I've said, the costs the cost is not cheap. In the Philippines, it ranges from 50,000 pesos to 150,000 pesos. So that's a lot of money, and you can actually buy a lot of things with that amount of money. So you have to make sure that you have that, regardless if you're gonna use your HMO or you're gonna use your PhilHealth or whatever insurance you have, because normally some insurance companies do not cover costs for gynecomastia surgery because they consider it as a cosmetic surgery. But interestingly, there are some who do. So bear in mind that there's always a possibility that these insurance companies will not cover the costs for your surgery, which include, the actual surgery itself. And of course, if you get confined, there would be a lot of, accompanying expenses. So, it's important that you have that money with you. Normally, the doctors would, ask you to pay in cash or, probably check. Or you can also do some, bank transfers if possible. So that's number one. The most important thing that you have to have with you is the money. So there. Number two, I'm also assuming that, you've already done your, physical examination with the surgeon. So the surgeon has already diagnosed that you have, gynecomastia, and it's not just, puffy nipples or pseudo gynecomastia. So you're sure that there's glandular tissues under your areola, so that you're actually a candidate for gynecomastia surgery. With that in mind, there are several things that you can do prior to the surgery. First thing is you have to lose a lot of weight. You have to burn those fats. Because in order for you to see immediate results after the surgery, especially if liposuction will not be performed, you have to shed those fats. Because if your chest area is full of fats, you won't really see for this one the shape of your pectorals, and even if the glandular tissue has been removed, it won't still look like the ideal type of chest that you would have wanted. So that's very important. You lose fats. So how do you do that? Of course, you do a lot of cardio, probably some weight training, exercise. So basically the goal is you want to get in shape. If you're really obese or overweight, you want to get thinner and lose those fats. But again, there's hope if you think you can really do that, or you don't have the time, or probably your current environment or situation would not permit that. Of course, some surgeons would offer liposuction. Again, this would add up to your cost. I don't know how much exactly a liposuction surgery would cost, but a good a good guess would probably be a minimum of 50,000 pesos. So it's on top of the payment for your actual gynecomastia surgery. So that way, if you're still sort of fat or obese or overweight, if you undergo liposuction, which is normally done together with the gynecomastia surgery, then you could expect better results. I actually underwent liposuction as well, aside from the surgery. If you've seen my first vlog in this series, I'll show it to you guys again. So here, there, that is the scar for the liposuction, and on the other side, it's here, there. So because when I had my surgery, I wasn't really in the perfect shape. I mean, I tried dieting, but probably I didn't have that much time to lose as much weight as possible. So I opted to get liposuction as well together with the surgery. So because of that, I think the results were much better than if I didn't undergo liposuction. So it's how it looks like now. I don't know if you like it, you hate it, I don't know. For me, it looks fine. This is basically like 2 months post-op. So there. So number 3, before you actually get scheduled for a surgery, you have to do this workup test, or like a clearance, a medical clearance, to make sure that you can actually undergo such surgery. Mind you, this is not like a very minor surgery, because like in my case, I was put under general anesthesia. So there's an anesthesiologist. Wow, it's like a tongue twister. Anesthesiologist who actually administered anesthesia. So there, you have to undergo this clearance test. So what does it include? First would be the blood test. So it's like a complete blood count with I don't know, like there's like clot time, bleeding time. So they have to see those. Some would also probably want to see like the creatinine. I really don't know what these are, but it's part of it. And then others would ask you to undergo X-ray, and then ECG. Yeah, I think that's basically it. And then you have to go to an internal medicine doctor for them to do the assessment, show them the results, and then they would like sort of check all the boxes and then tell whether you're a high risk or low risk for this procedure, for the surgery. And if you passed, based of course on the results of your test, then they would sign it, and then you can actually bring the paper with you on your surgery date. That means that you're eligible and qualified for the surgery. Okay, so your question now is, what if I don't pass the clearance test? Well, normally what will happen is they would ask you to postpone the procedure. Okay, because unless you really want to take risks. Remember, every time you go you undergo a surgery, there's like, I don't know, it's like there's like a paper, it's like some sort of waiver that you have to sign, which shows that you actually approved of it, and that anything that could happen to you, the doctors involved would not be liable. I know it's unfair, but there's some sort of paper or waiver that you will sign before any operation or surgery such as this one. So I suggest that if you didn't pass the clearance test, then you do something. Of course, if there's a problem with your blood pressure, if there's a problem with your heart rate, then there are medications that can be taken. Basically, there are many things that you can do so that you'd be ready for the operation. So there. Of course, there would be people who would argue, what if I will not undergo general anesthesia, just local anesthesia? I'm not sure about that, if they will also ask you for a clearance, but probably they would, because it's still a surgery. Again, guys, better safe than sorry. In the past, we've heard in the news that there are several cases of some medical malpractice where their patients, the doctors did not require their patients to get this clearance tests, and then they ended up dying. So you don't want that to happen to you. You want a better chest. You don't want to die. So again, better safe than sorry. So the clearance tests are important. Another important thing, number 4, would be fasting. Normally right before your surgery day, probably the night before, you don't want to eat food or drink lots of fluid. Probably just sip some water and that's it. It's important that you fast so that, I don't know, because when you're in anesthesia and you're unconscious, I don't know, if you have like a full stomach or you have like drunk a lot, then your body could probably react in a weird way, you know. You could, especially during the surgery itself, it depends if you're awake, probably not because you're conscious, but if you're under general anesthesia, then they would probably ask you to wear like adult diapers, because when you're under general anesthesia, you can't really control what's, you know, happening inside your body. So it's important that you fast, because also when you take food or sweets or anything, it could affect your, you know, your blood chemistry, basically your bodily, you know, your body processes. So it's important that you fast. The last thing that you have to bear in mind is you have to bring someone with you. I know with this kind of surgery, you would be hesitant to probably ask your friends to tag along, or probably your family or your significant other or special someone. But just be sure to, you know, just have someone accompany you. Because as I've said, I don't really consider this as a minor surgery, because right after the surgery, there's pain like any other surgery, and depending on the medications that were administered to you, you may lose some, you know, consciousness. You could be groggy, or it really depends on how your body would react. You know, there could be nausea, there could be some headache. Your sense of balance could be affected, and some of your senses could be impaired. So it's important that someone is going to accompany you, help bring you to the hospital, to the clinic, to the operating room, and then, you know, so that after the surgery, because the surgery usually takes from, I don't know, it really depends on what will be done to you, from 1 hour to 3 or 4 hours. So just be sure that after your surgery, if you're an outpatient, if it's on outpatient like basis, then, you know, you have to have someone with you to bring you home. Or even if you're confined, then you'll be brought back to your hospital room. It's still important that someone will be with you to assist you, you know, like when you just need to eat or probably drink or go to the washroom. So it's very important that you bring someone with you. So let's do a recap of the 5 things that you have to prepare for before your gynecomastia surgery. So number 1, this is assuming that you already have a doctor, you already did some, you know, consultation with a surgeon. So number 1 is the budget. It's, you know, probably the hardest to comply with unless you're born rich. So you have to have the budget. That's important. Number 2, you have to lose as much weight as possible. You have to burn those fats. It's easier for the doctor to operate on you if you have less fats, and then they could easily see like the glandular tissue. They could easily remove it, and, you know, it's easier for them to maintain the symmetry of your chest. So it's important that you lose as much, you know, weight as possible. Number 3 would be to undergo this clearance exam. So again, it could be an x-ray, an ECG, a blood test, or they could add some more, but you have to undergo it. Remember, no clearance, no surgery. So number 4, this is right before your surgery. You have to do some fasting. So again, fasting is very important, because if you eat or drink a lot before your surgery, then you don't know how your body would react when you're already in the operating tables. Lastly, number 5, you have to have someone with you, someone to accompany you before the surgery. And of course, even after the surgery, that person has to be with you to help bring you home. So there you have it, guys. I already shared with you 5 important things that you have to prepare for before the surgery. I hope you learned something from this vlog episode. So thank you so much, guys, for tuning in. If you enjoyed watching this video, please don't forget to give it a thumbs up. If you're new to my channel, please consider subscribing. Always remember to be nice. I'm Nashti. Till then.